Hello everyone, welcome to EduTab, and I'm really sorry for the delay. My camera had stopped working, so currently I am live with the laptops one. I hope that is fine. And according to what Pooja has said, Pooja, see, this is as this does not come under the government schemes, right? Uh, Domain. So what I'll do, I'll just convey the your request to the concerned faculty, okay, and we'll come up with some of such topic if we can come up with, or whatever be the best issue we can sort out, we'll help you with that. All right, so today we are going to do Ayushman Bharat. So why we talking about this particular scheme? Okay, so basically what happens, so see here, if you look at the recent news, or even if you're doing current affairs, you must be aware that there are a lot of news that is there in healthcare sector, right? So that is why it is important to understand that what are the flagship healthcare schemes that we have, and how it is helping the citizens of India, right? But before starting, here's an announcement for all the aspirants who are preparing for central regulatory bodies. We have come up with one-stop solution guide to all the queries that you must be having regarding the organization you want to join. For example, if you want to know about RBI and NABARD SEBI, everything has been comprehensively covered, along with what will be your role once you join the organization. Once you understand that, you would want to know about the recruitment process. So how many phases are there, what is the pattern of each phase, how many questions are asked, what sort of questions are asked, and also along with comprehensive coverage of the syllabus, of what should be the right approach if you're going for self preparation for the examination. Everything has been comprehensively covered here in these e-guidebooks. So do not miss the opportunity. You can download them free of cost from the link that is provided in the description box below. All right, so now let's start off with the session, and we'll understand from the basics, then we'll move ahead. Okay, so whenever we talk about any country and we talk about how we have to actually focus on the health of the citizen, because now see, if health is good of a person, then he'll be able to do work, and if he will be able to do work, he'll be able to check on the livelihood needs of the family, and also this will indirectly leads to the GDP of a country, right? So for a country to prosperous, citizens, they must be healthy. So how it can be achieved, right? First of all, we have to provide good quality. Okay, so quality facilities honi chahiye, for people who are ill, right? Along with that, affordability is also one of the reason. Okay, affordability, like for example, in case of USA, if you look at it, there the facilities are a lot, there is a lot of facility, however those are not affordable, right? So in such cases, they had to have some health insurance. If they do not have, they will not be able to afford, like they like for example, in India, very less people they have these insurance right now, right? Which is bad thing, but still, like, it is still affordable. If you're going if you're having a fever or minute issues, you can still do something about it. But in America, it's very difficult, right? So here in India, because here people we still have comparatively the per capita income, it is still low in compared to America. So what the government has done, they have focused on two factors, that first of all, we will provide quality facilities, and also it should be affordable. Okay, so there were many schemes that were running initially. So what the government decided, that whatever be the initial ones, we'll just subsume into the one that they have launched. Which year, we'll just look at it. Basically it's 2018. चलो अभी बता देती हूँ, so that you don't get confused. So 2018 में नेशनल हेल्थ प्रोटेक्शन मिशन आया, जिसको आयुष्मान भारत के नाम से भी जानते हैं. It is also known as Ayushman Bharat. And here the previous one, there were two, राष्ट्रीय स्वास्थ्य बीमा योजना, and one was senior citizen health insurance scheme. Both were subsumed under this one only. This caters to the broader spectrum of the citizens, but the previous one have also been now included in it. Okay, so launch year, as we have already discussed, it is 2018. And as we know that such kind of schemes can be come under which ministry, so answer is here, Ministry of Health and Family Welfare only. Okay, so this particular ministry will undertake of everything under this, but there should be an implementing agency as well, right, which will be actually checking about that all the components which were expected under Ayushman Bharat, have they been fulfilled or not, right? So that is why for that we have National Health Authority. This is the implementing agency at the national level. And the same thing at the state level, we have State Health Authority, which will take care of everything. All right, now let's talk about objective. So what is the objective of Ayushman Bharat? So first of all, to achieve the vision of universal health coverage. Okay, so we have a sustainable development goal also 3, which is the third one, which focuses on the well-being. Okay, so here the aim of the scheme is to have that health coverage. Okay, universal health coverage, this is the vision of this particular scheme, with a shift from the fragmented, you can say the institutes we have currently, the system, the health system that we have, it is quite fragmented. In some areas there are, in some regions there are facilities for primary healthcare, but there is nothing for secondary or tertiary, while in some areas there is facility for secondary, tertiary, but there is nothing that has been thought of for the primary kind of diseases. Okay, primary healthcare is what basically you caught cold, right? So you caught cold, you caught fever, such kind of diseases which are, you know, at the initial stages, these are known as primary. Okay, then secondary, step ahead, and tertiary includes your operations. Okay, and bigger diseases, cancers and all these all things that are included. Okay, so shift we have to make from this fragmented section towards a comprehensive, means in a wholesome manner, need based healthcare service. The need based healthcare service is very important, the taking care of the need of the citizen. What is the aim? To provide a health coverage of 5 lakh per family per year. So under the scheme, as we talk about the affordability, so affordability basically means to, you can say, help the citizen, right, to provide with financial support so that they can actually undergo the treatments that are there, okay, that they require. Now this 5 lakh per year for family, it is not for all the citizens of India. Okay, in the further slides we will look at, we have a dedicated slide for this. Okay, Jan Arogya Yojana, it comes under the Jan Arogya Yojana, which is a component of Ayushman Bharat. Okay, so under that we have 5 lakh per family per year facility, and for what? For secondary and tertiary care hospitalization, because the money that is required is lot, and the family might not have that much money. Okay, then we have to cover over 10.74 crore poor and vulnerable families. You have to keep in mind that this particular data is for the families, we are including families. If you are going to include the individual numbers, that is going to be around 50 crore. Okay, and this constitute around 40% of the lower section of the society. देखो, we can understand that if we are providing 5 lakh per family per year financial supports, of course that will be for the who are not socio-economically well in our in our country, right? So this particular scheme focuses on them, like the benefits of this 5 lakh per family will be provided to them, so that the lower section who could not afford the healthcare facility, and that is why they ignore the primary, whatever be the primary sector diseases are there, primary jaise humne samjhi, right, cold, fever, all that, all the basic, the initial stages, because if they'll ignore, it will move ahead with the secondary and tertiary advancement in the diseases, there will be such advancement, right, and then people, they will not be able to afford it, right? So that is why that particular section is being kept in mind. So now, as we have understood, in Ayushman Bharat we are talking about, first of all, there is from fragmented, there should be a comprehensive need based facility that should be provided, right? So first of all, this talks about creating health and wellness center. So these are basically the clinics that you must have heard or seen in your places, right? So this clinic, basically there should be more clinic should be made, so that at least primary issues can be solved. And then it talks about Pradhan Mantri Jan Arogya Yojana. So now this factor actually focuses on the secondary and tertiary components of the this health industry. Okay, so we'll start one by one. Take a health and wellness center. So one is, government announced the creation of 1,50,000 health and wellness center. These are the clinics that should be made. Okay, and if there are existing sub center or primary health center, this will also be transformed in accordance, in line with the facilities that will be provided under the Ayushman Bharat Abhiyan. Okay, deliver comprehensive healthcare. Ab dekho, we will make these 1,50,000 health and wellness centers, that we have understood, right? And we have also understood that these will be in line with Ayushman Bharat. Okay, so what are some of the things that are included? For example, near home covering both maternal and child health services. Okay, means clinics are basically nearby your home only, right? Hospitals are far away, in the far away places, right? So in the nearby region only, the maternal and child health services will also be included under these health and wellness centers, so that they can actually go and treat themselves, right? And non-communicable diseases, including free essential drug, and if there is some essential drug that should be given to the patient, that will be provided free, but of course only for a section of society. And diagnostic services. Diagnostic means some tests that are being done, right? So for example, blood test or any such sort test is done to identify that if that person is suffering from a particular disease or not, right? So for that, some tests are done. So some free essential drugs and free diagnostic services will also be provided. Okay, crucial role in creating awareness about PMJ. Okay, so usually what happens at the initial stage, for example, the person has gone, okay, and maybe they thought they are in the initial stage, so they went to the clinic, but in the clinic they got to know that maybe the disease has been advanced, or maybe it can be the case that it has been told to them that if they don't take care of it, it might have further advancement, right? So in such cases, it means what? So secondary and tertiary care we are talking about, okay. So in such cases, they will be even aware about Pradhan Mantri Jan Arogya Yojana. This is actually that 5 lakh thing that we have studied, no? So they will be aware about it, so that they would know that okay, they have this financial security with them, assistance for them, and they can actually cure themselves, okay. Screening for non-communicable disease, follow-up hospitalization comes among others, okay. अब इसमें critical role when we are saying, so first of all we are saying awareing them about the health benefits that they can actually have in the secondary and tertiary care. Screening for non-communicable disease, okay, such diseases which are non-communicable, okay, taking care of it. And follow-up hospitalization. What is follow-up? So basically in hospitals when we go, sometime doctor tell us, right, that come after 10 days for a follow-up, okay. So that is follow-up hospitalization comes, okay. So that will also be included, okay, under this health and wellness center, okay. Then again, why is it so? Why 1.5 lakh centers will be made? This will be made so that the pressure on the secondary and tertiary hospitals can be reduced, as we have understood that if some particular disease can be prevented at the very first stage, even the secondary and tertiary hospitals, they would have lesser burden for expensive treatments by investing in preventive primary health facilities. That is why government is focusing on reducing the burden on the secondary and tertiary expenses that will be done by first of all diagnosing and curing the disease at the very first step only. So that is your health and wellness center, okay. Now next very important component under Ayushman Bharat is Jan Arogya Yojana, okay. Jan means people, Arogya means disease free, Yojana is basically scheme, okay. So this again, it talks about the 5 lakh per family per year, irrespective of the number of family members. What does it mean? It means that if the family members have 5 members, 10 members, 3 members, it does not matter, they will get 5 lakh per year, per family per year benefit every year, okay. So it covers up to 3 days of pre-hospitalization and 15 days. So along with whatever be the cost that will be used to cure the disease, right? So along with that, in addition to that, 3 days of pre-hospitalization. For example, somebody is going for a surgery, right? So they have to pre-hospitalize before the surgery, right? And maybe the surgery has been done, and now they have been kept in hospital for some time for the under the observation, right? So that is why it's being said that along with the whatever money that will be used for the curation of disease, which should come under 5 lakh only, of course, okay. So 3 days of pre-hospitalization, and in fact 15 days of post hospitalization is also covered, okay. So means, for example, somebody, for example, 3 lakh, for 3 lakh the surgery has been done, right? But there were additional 20-30,000 that was taken for pre and post, or maybe post hospitalization, right? So they can avail that also, but it should be up to maximum 5 lakh only, okay. It is a centrally sponsored scheme. What does it mean? Jan Arogya Yojana is basically centrally sponsored. It means what? Basically it means that here the funding will be, whatever money funding that will be required, it will be divided between the central government and the state government, okay, because it is sponsored. Had it been sector, the all the amount will be borne by the central government only. So here it is the normal sponsored scheme. We have some ratios, right? For example, 60-40 in the normal states, okay, 90:10 in case of northeastern states and Himalayan regions, and then we have for UTs, for which do not have legislature, their 100% is funded by the central government, okay. So centrally sponsored hai. Then benefit of this particular scheme are portable across the country. What does it mean? It means a card will be made of yours, of your family, okay. So now it's not like that card can be utilized only in your region. So it is portable, means it can be utilized all across India, okay. And especially can avail person who has enrolled for Pradhan Mantri Jan Arogya Yojana. They can avail the benefits both in public and empaneled private facility. Public means all the government hospitals, they can avail this money, and empaneled means some of the private players or private hospitals, they have this memorandum of understanding with the government, and there also you can avail the benefit. So for example, for that, what you have to done, you would have to actually research that which hospitals they come under the particular scheme, and which facilities come under the scheme in that particular hospital, right? So for that, if there are present, because some prefer private hospitals, right? So in such cases, they can even do so. Government has come up with this one other option also. Okay. Then subsume this particular Rashtriya Swasthya Bima Yojana. So you can understand Bima is basically insurance, right? So there was an insurance scheme which was before, however there is some modification has been done, and now it is Jan Arogya Yojana. ठीक है, तो अब पहली वाली whatever be the previous scheme was, it has been subsumed under this. Okay. And now we are saying that only selective people, they will be given this particular benefit, right? So that will be decided or based on the latest socio-economic caste survey data covering both rural and urban area. Okay. And who require. Now see, this is all about the Ayushman Bharat National Health Protection Scheme. However, there were two more components that were added in 2021, which talks about better infrastructure. So in 2018, when the scheme was launched, we understood that 1.5 infrastructure should be like they need to be set up, the health centers need to be set up, right? But more about the detailed information of the infrastructure, how it should be made, what are the things to keep in mind, this particular section. And another about the digital mission, because then the government decided why not to, why every time the patient would have to visit the hospital, because that will that is time consuming also, and lesser number of patients, like many patients have to wait a lot, right? So that is why this digital mode was this was introduced in 2021, which has its own feature. So these two we are going to cover in the next lecture, because then this lecture will be very big, right? So in next lecture we will cover these two components and understand what are the features of them. Okay. So there is a homework in front of you. Which states have not implemented Ayushman Bharat Yojana? As we have understood that it is a central sponsored scheme, so there are some states which have not they have not accepted this particular scheme. So you have to tell me which are them, because see, exceptions can be asked, right? Because if something is generic, there are lesser chances of them being asked than the questions which are exceptions, right? Which the things which are exception. So that is all in this video. If you like the video, kindly subscribe to our YouTube channel. You can also join our Telegram channel to get the PDF of this and every lecture that we provide here on YouTube. And that is all. I'll look at some of the comments that are there. Good afternoon, Dexon. We have hello, yes, Chetak, yes, that's right. Mohit, good afternoon. And okay, Pradyuman, namaste. Okay, so that is all. Okay, so if you want me to cover any scheme, do let me know. I'll make a session on that. Okay, I have some suggestions already by you all guys only, so I'll make them, and then you can add more whatever will be in news and can be expected in examination, the nearest one, which is NABARD now. So we'll take care of that. Okay, so thank you everybody, and all the very best for your exam.